city. I also wanted to recognize the Center for Urban Population Health and Dr. Ron Sisler and his team for the development of a master birth outcomes registry. That data that's in that outcome registry allows us to aggregate information, and we'll share some of that with you today. And then there are various agencies I want to thank who joined us here today, and they've been key partners in this fight against infant mortality here in Milwaukee. I think that's key. You'll hear that theme throughout today's press event, that this is about a partnership. The Milwaukee Commission on Domestic Violence and Sexual Assault, another key partner that's been at the table, and that's part and parcel to what we see in terms of infant mortality in our community and trying to push that back. And we're certainly pleased that we have the Children's Health Society of Wisconsin in the room as well. That's another great partner. The rate at which babies less than 1 year old die is a major barometer and indicator of the health of our community. And that's every community nationwide and globally. The rate in Milwaukee has not been ideal, but today we're here to share and showcase a significant step in the right direction. And for that, I'd like to introduce Mayor Tom Barrett, who will share some of this exciting news regarding that finding. Mayor Barrett.
Good afternoon. I always love coming to St. Joe's. This is the place where my wife gave birth to our first daughter, our second daughter, and our third daughter. So there are very warm feelings for me when I come into St. Joe's. And welcome you all here. I want to especially welcome our former infant over there, the little guy. Didn't have been here, but the males are outnumbered by the women here, so I was glad to see the company there as well. Several weeks ago, I was able to stand with Bevan Baker and announce a significant drop in teen pregnancy in the city of Milwaukee, something that's been a major concern for us for many, many years. And today we're pleased to make another significant announcement. And this is also a very, very pleasant announcement, and that is that the city of Milwaukee saw a 20% drop in its infant mortality rate in 2007. Our data shows that infants who died in Milwaukee declined from 140 in 2006 to 111 in 2007. That equates to a drop from 12.3 deaths per 1,000 live births in 2006 to 9.8 deaths per 1,000 in 2007. So 110 per 1,000, and we're going to go even lower. That's the goal. That's what we're trying to do. And we're able to do this because of the strong partnerships. We're here today, obviously, at St. Joe's, who's been a strong partner. We've been able to establish a very strong partnership with Columbia St. Mary's. And that's not to mention the tremendous staff we have in our own Milwaukee Health Department, where we have people who have committed their lives to doing everything they can to reduce the number of infants who die before they reach age 1 in this community. And so when I look at barometers of quality of life, when people look at barometers of quality of life, teen pregnancy, infant mortality are two measures that are often looked at. And it just is great to know that our city is going in the right direction for both of these very, very important barometers. But the fact remains that our babies are still dying, notwithstanding this significant improvement. And that is something that is disheartening, I think, for everyone in this community, certainly everyone who loves babies. All deaths are tragic, but in particular, I think that we get concerned when they involve our smallest citizens, and that's why it's so important for us to redouble and do everything we can to continue this fight and make the home visits, have the prenatal counseling, make sure that women, once they find out that they are pregnant, that they have access to health care, and shortly after they give birth, continue that access so that we can make sure that that most precarious period, before birth and right after birth, are periods when we are doing everything we can to be supportive. I'm greatly encouraged by the numbers that we're seeing, and I think all of us should be. But again, I'm here to announce the good news, but to announce that we're not done yet. And we're going to do everything we can to do more. We've got a lot of community partners, we've got a lot of resources to tap into. And it's my hope that the partnerships that we've begun, again with Columbia St. Mary's, with St. Joe's, with other hospitals and health organizations, can continue, because we are seeing real progress. So with that, I'll turn it over to Bevan, and I want to thank everybody here who's been involved, because this has been truly a team effort, in particular the workers of the City of Milwaukee Health Department and Mike Fire. Thank you.
Thank you, Mayor Barrett, for your continued support and leadership in the citywide effort to reduce the rate of mortality in our community. As the mayor mentioned, infant mortality, like many other public health concerns, requires a whole community support in order to sustain improvement. And we've got just that. And I'm pleased to be joined by Alderman Michael Murphy, whose district has made a significant contribution toward enabling parents to properly care for their children. So without further ado, Alderman Murphy.
This is a great news. This is wonderful news to say that 20% reduction in infant mortality rates. That, coupled with the news that was announced last month by Mayor Barrett about the reduction in teen pregnancy in our community, this is the right direction we want to see our city go. And I want to compliment Wheaton and, of course, St. Joseph's. Most people may not realize, but over 4,000 births were in this hospital last year alone. That's 30% of all the births in our city. And it's the nurses and the doctors who have been in this business for 20 years. That continuity, that expertise, that professionalism here at St. Joe's has played a big part in their prenatal, along with their neonatal care and intensive care program. But the cost for children who are born prematurely is not only a cost to the parents, it's a cost to society. I'm sure St. Joe's could tell you it'll be over $100,000 a child in a neonatal intensive care program. That's why education is such a key component of the health department, education by Wheaton Franciscans to talk about the issues of making sure women get the proper prenatal care, whether it's the elimination of smoking, proper diet, education, reducing stress in their lives, the Pack and Play program that is sponsored by St. Joe's. Those are key factors in educating our youngest citizens the importance of having good, proper health care. The teen pregnancy issue is such an important issue too. I want to acknowledge United Way, which has really led a campaign once again on education, because many of these preemie babies are born to really children. Our children are having children, and we all know the associated costs with that. But when you have children at the age of 13 and 14 having children, what we have is in many cases these children being prenatal programs. So it's such an important message that we are sending to our community, that we can reduce these rates. And in the long run, it's the best for the children, it's best for the mothers and fathers, and it's of course best for society to have children being brought up in a healthy environment. So once again, my appreciation to United Way, to the leadership of the Milwaukee Health Department, and of course St. Joseph, who plays such an important part in this community and in this neighborhood which I represent. I want to say thank you again to St. Joseph. We need your leadership, we need your commitment here in Milwaukee, and we appreciate what you're doing. Thank you very much.